Hey everybody, today we're going to talk about resourcing and resources. And we have a wonderful guest, my friend, trauma specialist and psychologist, Dr. Alexa Altman. Thank you for taking time. She has taken time out of her very busy day and busy schedule to help us understand resources, why they're important, how we use them, especially in trauma work, but also in therapy in general, because you guys know I talk about them a lot and their importance, and I know some of you hate them a lot. And so we'll talk about why they're so important, why we do spend time doing them, and all of that. Now, from my perspective, I always have defined resourcing or resources kind of the same way I do coping skills, where we might need, when I'm feeling really overwhelmed at work and someone pokes my buttons, I need to do something so I don't lash out because it's not helpful in the moment. Or if I'm very tearful and I have to go into a meeting or I have to see someone and it's not the time, I need some techniques and tools that I can use so that I don't cry in front of that person. It's not appropriate or whatever. I kind of see them as just, like a spider web of support and resources and things I can pull on when I need them, depending on what's going on and what my emotional charge is. What do you think?
I really like that. I really like that description, because what you're describing is that you need many, and depending on where your system is or what the situation calls for, it helps to have choices. I think it creates agency too. If you're a patient new in therapy, or a person in the world and overwhelmed with what's going on, just to feel like you have choice about how to support yourself and you have ways to access that kind of self-care, I think you're in a really good position. I think it's also paramount if you're starting trauma therapy, any form of trauma therapy, that resource development, we call it resource installation, can be weeks or months.
I think that's the frustrating part that I hear from my viewers, is that they've been in trauma work for, let's say, 6 months, and they're still resourcing sometimes. And that can be really frustrating. So I guess help us better understand why that can take a long time and what that kind of looks like.
Yeah. So in trauma therapy, the first stage is treatment planning and history. Second stage...
I love that you said treatment planning.
Yes.
Because I talk about the importance of that in videos, and I've gotten pushback from other clinicians. They're like, it just takes shape. I'm like, no.
Yeah, you need a thorough history, developmental history, trauma timeline.
Yep. Goals, symptoms.
Right, symptoms, really evaluating, like kind of getting the narrative. Why do you think you're having these symptoms? Where do you think they come from? And we might discover that together. Then it really is about that rapport building and preparation. That is the second stage of trauma therapy. You do not move past preparation and move into trauma reprocessing, which is really starting to set a target and then start to move into desensitization until a person
So a target would be like a traumatizing event?
Correct.
Okay.
Correct. Yes. A traumatizing event or an experience, a person's having a specific symptom, that it's really irresponsible to move into any kind of big trauma reprocessing if a person cannot calm their nervous system. And that calming can look like any of some of the tools that you were describing, of being able to pull. I use this all the time. If you can't swim thoroughly to the deep end and swim back to the shallow end, you shouldn't be swimming in the deep end of the pool.
I love how you talked about building confidence, because I talk all the time in DBT, or dialectical behavior therapy. We talk about building mastery and the importance of feeling confident, because confidence goes a long way. It's a wonderful resource to be able to pull from when you're going through something tough, because you at least have that some sense of self, and that you can do something really well.
Well, I think what it also speaks to, as you say that, is, if you've been through an overwhelming event and you felt powerless or helpless, you lose a certain trust in your body and its capacity to be successful or to keep you safe. So I think, as you say that, as you build those skills again, it's like, finding that discovery that I can trust my body and that my body won't betray me.
Yeah.
And it can do it before we get into maybe the betrayal of the body.
Which is beautiful too, because that sense of self and that can't trust my own decisions, can't trust what I feel, especially if you were gaslit or manipulated, groomed, if it was sexual abuse in the past, like thinking that, no, I did something to cause, you start to not believe in yourself at all. I really liked how you said that it would be irresponsible to take someone out to the deep end without knowing they can swim back to the shallow end. And I love that analogy, because I think that's why, unfortunately, some people who maybe seen a therapist or a psychologist who isn't trained in trauma can become re-traumatized, right? Because if we go too fast, too much, too quickly, we can't swim back. And then it's like it's happening all over again. And I think that ties into why resources are important, because we don't want to be re-traumatized.
Right. It kind of gives us a break. You know, if you think of trauma as the gas or the intensity of the arousal or activation around the trauma, you have to be able to know how to break, how to slow it down. Trauma is too much, too soon, too fast. And trauma therapy can be too much, too soon, too fast.
Yeah.
So Peter Levine talks a lot about titrating, a little bit at a time. An EMDR therapist, a trained...
Shake it out.
Right. A trained EMDR therapist can also really get a sense in the session if somebody's getting blocked, you know, stopped or blocked, or it's not moving, and skills different ways to kind of help the process move along.
Yeah, and I love that though, and I understand, I want people to know I hear them on why it can feel so frustrating, because I know that when I go to do something, I want to do it. And I'm ready to do it. And people finally are like, okay, I'm ready to do this. Let's do the trauma work. Ugh. And then it feels like it's not happening.
I want to speak to that for a second, because I know therapists that get so much recovery from just the resource work. And I the way I think about it, there's actually like some studies that show this. You know how you can't flex your bicep and also flex your tricep at the same time because they're opposites? It's like you can't be in a resource and in your trauma response at the same time. So as much as you want to get to your trauma, oftentimes what's pushing that is we're kind of driven towards the trauma physiology and kind of want to get in there. And it's also familiar.
And I say it's comfortable. Even though it's uncomfortable, there's some kind of sense of normalcy in it.
Yeah, and familiarity. And so I think about that resource. It's like we're establishing more expansive states, safe states, nurtured states, protective states, wise states of mind.
We're building that resiliency space broader and broader.
And some people get so much symptom relief just in the resource work. We still have to get to the trauma piece, but as far as functioning and coping and kind of dealing with everyday stressors, which is really what people want, is to feel like they're functioning better, you can get that from the resource work. So I don't think it's like, oh, let's get to the real work. It is the real work.
Yeah, you're already doing the real work.
You're doing the work. It just doesn't maybe look like what you pictured it was going to look like.
Yeah, it's not like what you thought on paper, right? Like in practice, it's different.
Yeah. Right.
So how would one go about installing, I was trying to remember the right word, installing a resource?
Yeah. So
and how would you pick them?
How would I pick the resource?
Yeah.
So I think a standard one to start with, I think you and I in another video a while back worked on this, is safe place. A safe place, a peaceful place. For some people, finding a safe place is very difficult. So we might look for, again, a place that's neutral, conflict-free. For some people, it's like a place doesn't even represent peace or safety. It's like playing my instrument or petting my dog. It can be something in your everyday routine that maybe you think is nothing and meaningless, but it's a neutral experience. It's something maybe you wouldn't say that you look forward to, but it's something that you know well. And it has kind of a sensation to it, an experience to it that you can tap into.
Yeah, like a routine. I was, when you told me this was last time we hung out a couple months ago, you'd said not everyone can find a safe space. And I talked with them about how sometimes it's this neutral where it can be like your morning routine, you can count on it a little bit, right? Like I get up around this time, I eat my breakfast, I make my coffee, maybe I unload the dishwasher, things that are very
consistent. Right. Because if we're looking for, our nervous system loves consistency. So if we could, and we're going to talk about tapping it in and what that means. So you can think about a safe, peaceful, conflict-free space, and you can imagine it, and you can feel it, and you can hear it, we're going to do a little exercise, and you can visualize it. And once you get the somatosensory experience of it, what we have found is if you pair that sensation of that safe place with the bilateral stimulation, that it just intensifies the positive feelings. So it's a way to really get your bang for the buck. If you're
maximize that resource.
We really want to maximize the resource. And the thing with the tapping it in is you don't even need to tap it in for very long. It's 6 to 12, about 6 to 12 taps.
Oh.
And the reason they think that that's like kind of the sweet spot, you can stay longer if it feels good to you, is that some people with a big complex trauma history will flip to the negative pretty quickly. So we keep it short, so we just like hold that positive state tight.
Gotcha.
And then come out of it.
So you don't let your brain wander too much.
Yes.
Because sometimes you can, because sometimes good or neutral things butt up against not good and neutral things.
Right.
So it's easy to like
Right. It's like you get into the bad neighborhood and then you're like, oh, how did I get in
it's
here?
It's like one street away.
It is.
Let's
It
just
can
stop
be real
there.
close. It can be real close. So we can install a safe and peaceful place. That's usually a pretty straightforward, easy one to start with in trauma therapy. The other is, and I love these, and I think it works, and we'll expand on them. You can also install an empathic figure, a nurturing figure. So for a lot of people, if you've had early trauma, maybe there wasn't a nurturing figure present, somebody to provide that like love, support, connection. So you could think of a friend, an animal, it could be a real or imagined person. Maybe it's somebody on TV that you thought like, oh, that person looks like they'd be incredible.
Some people do that, especially as children, because you'll watch television so much, especially if your parents are like not as active in your life. You can be like, the babysitter can be TV. And I've heard from some of my patients over the years that they loved, late night talk show guys, or the person, like I talked about this on Sean and I's podcast, but everybody had their morning cartoon person, like mine was Ramblin' Rod. And so some people could, like attach to those figures as well, because they're consistent, they can count on them, and they seem super caring.
So what's most important when you're installing a resource, like a nurturing figure, is that you bring up a picture of them if you can, or an image. Some people are not good visualizers, so you can just imagine. You don't have to actually visually see them. And
I'm not a very good visualizer.
Yeah, and you don't have to be. Some people, that visual channel is just really wired for that. But you can imagine them, or imagine how you felt when you were in connection with them. That's probably the most important piece. How did I feel when I was in the presence of that character? How did it feel in my body? If you struggle with feeling sensations in your body, that's okay. You can maybe just notice the emotion. Because some people can't feel things in their body. That's okay.
Yeah, because that disconnect's very common, especially in trauma.
It's very, very
common. It can be hard to be in our bodies at all.
Right. So by tapping in that figure, you're really tapping into the quality of the experience of being nurtured or cared for.
Okay.
So even though it's in that figure, it's actually living, it's kind of like, channeling feels like a strange word to say, but kind of like opening up that channel for yourself
that
to
makes
receive.
sense. Yeah, so that you can feel nurtured.
Yes.
I always talk about bridge statements. So it's almost like by opening up that channel, we're saying like, I'm open to the belief that I could be nurtured.
Right. I know,
possible.
I have a sense of what it feels like. And we can expand that with the tapping.
Okay. So we have safe and calm place. We have nurturing. Am I missing one that we went through already?
Nope. Protective figure.
Oh, okay.
So protective figure, it could be, again, somebody from your past. It could be a figure on TV, maybe a late night talk show person. It could be an animal. It can be anything. It could be a spiritual figure. Very often, actually, in my office, it will be Jesus. Or the Buddha, or, so anyone that represents protection. Why protection is so critical is more often who's coming in to work with kind of early childhood abuse, nobody protected them.
Yeah.
So it's just the experience of feeling in the presence of somebody that protected and what it feels like. So somebody recently asked me, do I have to picture them protecting me? Like the feeling of them doing something? You actually don't, just that they have that capacity.
Okay.
If it helps you to picture it, do it.
Yeah. Of course, it's always like whatever works for you, right? But you don't, that's good to know, because that could be really hard for people to imagine being protected.
Right.
And it actually happening.
Right. It's sometimes nice to have many protective figures. I worked with somebody recently who had an army, and, all of a sudden they like multiplied, and she had a force field around her. And that's what she needed to feel safe and protected.
More than just one.
More than just one.
Which makes
with
sense.
any of the figures.
I watch enough crime shows. I feel like I want quite a few detectives
like
on my
a
case.
force team.
Yes.
A squad.
Yeah.
And then the other resource, and we're not limited to these. I'll actually give you some other ideas of things you can install. Another one is a wise figure. Oftentimes when I do wise figures, sometimes people will put their 80-year-old self, the one that's lived a full life, into that, how they picture this wise person or their grandparent, or again, a spiritual figure. And if we think about like what that wise person suggests, often it's like clarity or perspective.
Yeah.
DBT, it's wise mind, right? So you're going to call up, again, more than one figure is useful, I think, in this respect, and what it feels like to be in the presence of that wisdom.
Interesting. Yeah, because the wise mind stuff, I mean, I do a lot of the DBT work, but I didn't even think about wise being a helpful resource, but perspective can be everything. Because if we are doing that hard work, we can become very, like, not pigeonholed, but almost like unable to see any other option or any other way out. And I feel like in the research that I've done, and even work with patients with trauma specifically, it helps to have alternative ways of thinking about it, because other ways can be not as emotionally charged. And so it's the same situation, but you're able to see it again from like a future self that's already survived it. And even now, I do a lot of inner child work stuff with my patients over the years, and a lot of that comes out of the fact that, like, hey, I survived this, but I need to find out how to talk to me then and tell me I'm going to be okay. And so if we can do that for now, if I can imagine older me and I'm the inner child, just, you know what I'm saying?
Absolutely.
It's really powerful.
Yeah, it's really powerful. I think also what you're getting at is, or what the resource installation does get at, is that we have access to all these parts that live inside of us. And sometimes when we're in that trauma response and our vision gets myopic and gets constricted, it's really helpful to know all these other parts live. So even though we're imagining, and sometimes people can struggle with that, like, is it real? I was like, well, it's what we're accessing inside of you that actually is real. So something else, if we were just going to expand some of these other resources and things you could look for, is maybe a time you felt courageous or powerful, or something that maybe an exchange that happened at work where you kind of felt, again, agency or a sense of like, stand up for yourself. You could install that experience. I think sometimes real life experiences can be really helpful.
They're a little stronger. I'd imagine it being easier to install.
Generally, when we're in our trauma reactions, we're on the lookout, hypervigilant for what's going to go wrong, what's the next danger. So sometimes what I'll ask people to do is, like, let's look out for some of these other resource experiences today and see if you can just find one. And then we'll kind of come back and we'll install that one, because again, our vision gets narrow because we're having to protect ourselves, and that's the kind of orienting we're in. So it could be helpful just as far as expanding. And then we can show what the installation process looks like.
Yeah, let's do it.
There's one thing that I wanted to add that I forgot.
Okay, that's fine.
The one thing that people struggle with the most is actually the nurturing figure.
Yeah, that makes sense that the nurturing figure is difficult, or the most difficult, because I hear from my viewers all the time, as well as my patients, that no one did that. And I find that when we don't have an example, it's hard for us to even imagine what that would feel like. Right. You know, if we had a parent who was just absent, or even just emotionally absent, right there, but not there for us, telling us it's going to be okay, giving us that we need. How do we come up with that?
Right. So what I often will use or like begin is, if you have a child, and you currently have a child, and you feel that love for the child, and to tap into your ability to nurture somebody else. Because
even animals, I think.
Even animals.
Having a fur baby.
Right. I mean,
like Leo.
We have a little one back there. I think you can see him. So yeah, just tapping into your own capacity to nurture, just feeling that is one way in. And sometimes people can't then turn that on into themselves, but just to tap into the deep love that it comes for caring for another. So that's just one way to start.
Yeah, and that's really helpful too, because you could kind of journal a little bit about like what it feels like to nurture and what love comes out of you. Even if you can't say, like you said, apply it to yourself, you could at least acknowledge what nurture is. And that's the first step, right? And then later we could hope that then we could apply it. But we have to start somewhere. We have to know we have to be able to describe it for ourselves first.
That's right. That's right.
Okay, so how do we do this?
Yeah. So if you were in my office.
Can they do it with us?
Yeah, you can do it with us.
Okay.
If we were in my office, I would probably go through all of them.
Okay.
It might take a long time. So you could use how we do the first one and apply it to the others.
Okay.
Because it's not that different. We're just picking a different figure.
Okay. Is this safe for people to do at home?
It is.
Okay.
What I would say though, if you're at home and it flips and it starts to get negative, or you can't find one, sometimes that can be distressing for people, then I would say pause, take a minute, open your eyes, and you also don't have to do this eyes closed. And I would say stand up, take a breath, go to a resource that feels most accessible. So if I'm going to ask Katie which one she wants to start with, but you start with where you're like, okay, this one's easy. I can do this one. And again, if you can't find a positive resource, go to neutral.
Okay.
And that, takes some of the pressure off.
So get into your routine, do something basic, maybe go for a walk, pet an animal, something.
Yep.
Okay.
Yes.
Okay, cool. Let's start. I mean, there's a lot that like the protector and the safe place feel good for me. But let's do safe place because it's kind of fun.
Okay. So before we start any tapping, what we're going to do is I'm just going to invite you to close your eyes for a minute and just go inside. And again, if you're comfortable processing eyes open, you can do that too. And we're just going to take 3 deep breaths. So just you can feel the air coming all the way in, letting the air all the way out. And I always say as you're taking those deep breaths, just to let yourself feel your chair or the ground, wherever you're sitting, just a little bit of grounding. Okay. And then I'm just going to invite you to bring up an image or imagine a place that represents peace, safety, maybe is conflict-free in some way. And just take a minute. If it doesn't come right away, that's okay. You have all the time in the world. So just really letting whatever image show up. And then just going to open up that visual channel if you can, of just taking in the colors that are there.
It was kind of nice to go there in my mind.
Okay. Okay. Are you still there?
Yeah.
Okay, good.
Yeah.
So once you have the image of it, and you have the sounds there, and you have any other sensations or emotions that you feel, so you're really going to make sure it's all the way called up, then we're just going to do about 10 taps, 10 to 12 taps. Okay? And so what you're going to do, you're going to start tapping when you feel it in your body or feel the emotion of it. Okay? And then we're going to pause, and then you're just going to tell me what you noticed.
It was interesting because my safe, it actually ended up being more than one thing, which is kind of interesting for resources, but it was my grandma. So I used to stay the night at my grandma and papa's house, which they're like next door where I grew up. And the upstairs bedroom, when you'd stay over at grandma's, she had like this other bed. So it was like their bed, and then you'd sleep like in the same room, but off to the side when you were little. And it was like the most comfortable bed. And I remember like tons of blankets, and they're like heavy, and it was just always so soothing. And my grandma, when we were younger, because I used to roll out of bed all the time as a kid, so whenever I'd sleep over, she'd sleep with me, and she'd have her hand on my arm, and she'd do this all the time.
So yummy.
Yeah, so wonderful. And I was like, oh, I miss her. She's so good. I have to go visit again. But yeah, so it was always very safe, because I felt like not only was I in a safe place, but with my grandma and like the coziness. Oh, so nice. Just delicious.
Okay, so just let's like take a minute, and I love that just came up, and I'm just going to invite you to tap that in again.
Okay.
And this time you said the word delicious, but it doesn't have to be that word. I just want you to find one word that represents that experience.
Okay. Do I have to say it?
No. You can or not. Okay. So what word was it?
Just security.
Security. Yeah. So what we did, and I'm still with your grandmother. I'm like, what are we doing? Right, we're with your grandmother now.
She is so great.
That word security, what we would do is we're linking that word security with the experience of grandma. So let's say if you were practicing this resource, I might say, let's use that security. If you're having a moment, life is in transition, maybe things feel a little less secure, let's bring up that word security and bring up grandma and just like let yourself kind of feel the comfort of her touch and the comfort of being tucked in that way and somebody looking after you in that way, that security, that secure place. And then we could try that out. You could try it out in real life. You could try it out before you come to the session, that there's really an opportunity for greater installation of that resource. What also often happens is it'll start to expand.
Yeah, it's interesting, even the tapping, because the thing that's funny is when you said to come up with a safe space, my happy place is always, I'm in Costa Rica with my ears under the water floating in the ocean with my friend Nina, and I can visualize it so perfectly and feel the sun. And I was like, oh, I'm going to go there. And then this memory popped up and I was like, no, that's actually more safe. That's like happy place, relax, but safe is there. So that was it. First of all, that was interesting to me, surprising me. But it did feel, I felt it much more intensely than I think if you just asked me about it and we were just chatting and it wasn't this kind of an experience where I'm like being more present, tapping it in.
Yeah, I think
I could feel it expand.
I think you really hit it. It's like having the experience and then really trying to drop in the best that you can and really get the sense of it.
Like imagine that you're there.
Right.
Which is very different than like telling someone about it.
Yeah.
So that is so fast. I mean, I see why it works and why it's important.
Right. And then what we could think about is that when you were talking about the web and having a lot of different to pull from, it's like, okay, we could pull from comfort, or we could pull from protection, or we could pull from wisdom, or we could pull from power or success, like an experience of success. So I think it also is, what is a person needing right now? What is the missing resource in their life?
Yeah.
So we could do all of them, and typically I will as part of the preparation, but I'm also always looking for what was really most absent and how do we call that in now?
Yeah.
You don't have to wait to have that experience to be able to really give that to yourself.
I could imagine that immediately when you said that, you pull what they need most, that I would assume that would often be the thing that's the most difficult, because I could imagine that most of my patients over the years would need nurturing, but it'd be really hard to come up with. But I don't think it's a far stretch to be like, oh, maybe we could find a neutral place that's conflict free.
Right.
Because I think that even though it's not easy, it's easier. And like I even said, going to my like conflict free safe space turned into like nurture. So I feel like that could maybe happen.
What I also really appreciated about your experience is that you were kind of open to what came in. And I think sometimes you can be surprised if you're willing to wait a little bit. I think there can be a little bit of like a performance anxiety in a session with the therapist. Like, okay, I got to come up with something. I'm like, you actually have time, and our nervous system is so creative. And sometimes it's just waiting to give you what you need.
Yeah.
So if you wait a little bit and wait for health, because I think oftentimes what shows up, and maybe neutral is health, is that's really what we're looking for in resource installation, is the health of your system. I can already hear a patient in my ear saying, but I'm not healthy. And I was like, that's not true. The trauma obscured the sun, right? The trauma is the clouds, the sun is behind it. It's just obscured, right? So if we wait long enough, we're going to get to the sun, the sunny stuff, or the blue sky, or however you want to think about it. But it sometimes takes a trust and a knowing. So I'm actually kind of curious if they experiment with it, again, short sets.
Yep, 6 to 12.
6 to 12. And with resource installation, unlike the trauma reprocessing, it's like a slower tap, but feel what's comfortable for you.
Yeah, and let us know down in the comments, like what came up for you. Were you surprised? Because there is something interesting to letting our body do what it was programmed to do. Because I think, again, going back to building mastery / being more confident or able to trust yourself again, it's a slow process, but it's only because we are choosing not to listen. Like I do that with my eating disorder patients all the time. They'll be like, well, I'm going to overeat and then I'm going to gain all this weight. Or what if I don't know when I'm hungry or when I'm full? And I'm like, you do.
It's our programming.
You do. We haven't listened to it in a long. It's almost like I learned Spanish in middle school, but I haven't practiced it in a long time. So it may take me a while to remember, but it's there. And it's still been speaking to me. I just haven't been listening.
I love that. I feel I've been watching all these shows on mammals and animals and these animals of different species becoming friends. And what I love about the show is our mammalian nature is to nurture.
Yes.
Our mammalian nature is to protect.
Well, dogs will take on other puppies that aren't their own.
Right.
Because they can, or cats. And, you see that all the time. Even horses taking on other animals within the farm as their children.
Right. It's in their programming. That health is there. So we're just calling on that health and strengthening it.
Yeah, I love that. Thank you so much. This was super helpful because I talk about resources all the time and link the coping skills and like how we could use them. But I think this is another way to, again, expand on them, because I was actually very surprised. I think it's me. I logic myself out of stuff a lot. And when I'm teaching, I'm logic braining. And so when I talked about it with people, it's more like, this is exactly what it should be. Not exactly, but these are the things. But if you give yourself time to really feel it, I think you'll be surprised what comes up. And that was really powerful. So.
Right. It's one thing to talk about, it's another thing to have an experience of something.
Yeah, so
very
much
different.
more powerful. Well, thank you.
Yes.
I hope you guys found that helpful. Again, let us know if you try this at home. Let us know what came up for you. Were you surprised like I was, or was it something that you already have gone to before? And did the tapping, kind of expand that either safety, security, neutral, nurturing, powerful? What came up for you? Let us know. I'd love to hear. And thanks again.
Yeah. Good.
Cool.
Okay.
Wait, God, that was your tears.
Oh, I know, it was good. That was like, my grandma's so like, she's like massive
I want to
nurturer.
be in that little bed.
It was my favorite.
Honestly, Katie, that was beautiful.